I don't know, sitting here, anything else.
I see it's 7 o'clock. I guess we probably ought to start. Everybody ready? Great. Call the meeting to order then. Let's all stand for the Pledge of Allegiance. Pledge of
Pledge
Allegiance.
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Can you please call the roll?
Byron Batcher. Marge Almer. Al Etzel.
Here.
Michelle Finelli. Myself, George Needles, present. And is there anyone on the call?
Joe Goldberg present. Good. Right, is there anybody from the public, that would have any comments on the agenda items? Here. Well. Dr. Goldberg, son. Very good. Having, nobody, public comment, we'll move on to, consideration for a motion to accept the minutes of July 13th, from the Board of Health meeting. Mark, all right? Second? All right. All in favor, please say aye. Aye. Any opposed? Motion carries. And next, we'll do the health inspector report.
Good evening. As of today, I have completed 65 annual health inspections. Have about maybe possibly 10 more to go. Been a pretty quiet month. Really was complaints unless George has heard any. It's hard to believe though, in December, that Wawa will be 1 year old, December 17th. So I haven't heard of any new business that are opening or closing. Haven't closed any now, thankfully. I do know Bogarts are doing some renovations, but no near future as far as when they're opening. And maybe George can give us an update on county health department.
Excellent. Good evening, everybody. So from a public health perspective, the county, the township was successful in their bid with the county in the lawsuit that was in the court system, where the township argued that we comply with the first class township code, which allows for first class townships to perform health inspections, have board of health, have health officers. So the lawyers have been asked to compile some additional information together and get that to the courts. And then there is an appeal period after that where the county would obviously have an opportunity to appeal if they so choose. But at this time, we are continuing to proceed forward as we have been. We've prepared the budget next year, which includes the township performing all the inspections and everything. And again, we do believe that service is a service that should stay local, as in the event of an emergency. Michelle is typically goes out in the middle of the night when there's a fire, things like that. So we have that level of service that we'd like to continue to provide. In addition, from something that may affect the Board of Health through the Emergency Management Committee, the Emergency Management Committee has, the township has contracted with a consultant to prepare a new emergency guide for Upper Chichester Township. And I do imagine that as this kind of gets a little bit further in the process, we are going to have some information that they're going to request from us to give to go along with some of the response in the event of medical type emergencies or what roles that we play. You all know that I'm a little hesitant to get us too involved because last time we did something like this, a pandemic broke out about 2 months later. So we will be very careful about the topics that we choose and what we talk about. And then just in addition to that, we have been getting quite a bit of information about public health programs through from various services throughout Delaware County, which we've been sharing out through our social media pages and our websites. So we'll continue to do that. And if anybody comes across anything that they find might be interesting for our general public, please feel free to send that over our way so we can push that out, keep people informed. Thank you.
Thank you. Anybody have any questions or comment? All right, then, a moment, if there's anyone on the line from the public, we'll listen to any comments from the public.
Yeah. Shape as far as, you sit for hours, every, Chester County has closures, Chester has closures, it's a mess.
We haven't had any direct involvement in that. We do get information from the ambulance services. I mean, their call volume has stayed steady within the township. It doesn't seem like it's having too much of a negative effect, but obviously, that's the delivery system. So once they get to the door, we don't know about wait times or things like that or what's going on there. Yep. Yeah, I agree.
Well, we're at the point on the agenda, which we have member comments, and I think we just had one. You have any comments?
Are there any sorts of updates as far as, COVID is becoming a thing of the past, but any statistics as far as where things stand? I also know there have been some other respiratory outbreaks and things like that, but any sort of statistics or data that's out there that could be pointed to?
So I would refer to Dr. Goldberg on this. Dr. Goldberg, do you have any information about COVID or any of the other respiratory diseases that are creeping up, and any information in regards to that?
Yeah, I don't have any specific statistics, but just in practice, there does seem to be an increase in respiratory illnesses. It may be part of people not masking, not washing hands as much, having more interaction, and being relatively hibernating for the last number of years due to the pandemic, that their resistance may be low. They're seeing germs they haven't been exposed to. There's an uptick in respiratory syncytial virus, which is seen in children. But we're expecting some of this normally every flu season anyway. So it may be more normal that we just haven't been used to because of all the precautions over the last few years.
Any member of the board have any other comments? Well, hearing no comments, I believe it's time for us to adjourn. Motion to adjourn? George? You second it? All right,
Second.
we are adjourned.
All right. Thank you very much.
Thank you.